My name is Brian Kirby. I'm a consultant dermatologist in St. Vincent's University Hospital. I co-run the largest psoriasis clinic in Ireland, which deals with people with the most severe disease. And most of these people require systemic medication to control their disease. So we see on average maybe 70 or 80 people with severe psoriasis every week. Part of this disease is your genes, or are your genes. It's the hardwiring of your immune system in your skin, which you've inherited. Okay. But your genes then interact with the environment, and there are certainly environmental things that can cause this to come on. It often comes on in sort of late teens, early 20s, and then there's a sort of second peak of incidence between 50, 55, but it can occur pretty much at any age, although it is uncommon under the age of 10. Okay, we don't see many kids with it, but it does happen. So those genes then interact with the environment. One of the commonest things, sore throats. So streptococcal sore throats can flare psoriasis in those people who are prone to get it. And it appears that your immune system, in getting rid of the sore throat, then starts to interact with your skin and cause the psoriasis to happen. And once it's triggered, it's a self-perpetuating process. Then there are certain other things that can make it worse. Heavy alcohol intake, cigarette smoking, certain medications, most of which aren't commonly used, and probably psychological stress. So a lot of people will tell us if they're under more stress at certain times in their life that their psoriasis gets more active, and that's not too shocking because we know that stress changes how your immune system works in quite profound ways. But then you get into a sort of vicious circle because psoriasis itself causes a whole load of stress, which makes your psoriasis worse, and you can go round and round in an ever deteriorating circle. When you compare the results of quality of life impairment in people with psoriasis, they will measure up as being the same, if not worse, than conditions that you and I would perceive as being far more life-threatening per se. But what we do know in people with psoriasis is that it's not necessarily what you see determines severity, is that even small amounts of psoriasis can cause a lot of psychosocial disability, particularly if it's on your hands or it's on your face. The average patient with moderate severe psoriasis will spend 2 hours a day looking after their skin, and so it's time consuming. That comes with a degree of expense. And the last issue then as well is that that amount of skin disease creates adverse negative reactions in people. So they avoid swimming pools, they avoid intimate relationships, they avoid going to places where they perceive that their psoriasis may be an issue. So swimming pools is a very good example of that. A gym is another good example of that. Intimate relationships then become more difficult. Again, because you feel less attractive, your self-esteem will be bothered, and the avoidance coping is about avoiding people's adverse reaction to your skin, and therefore an intimate relationship would be one of the things you would strongly try to avoid if that's what you're thinking. One of the things that most people don't remember is the skin is the largest organ that you have, and if that decides not to work properly in a major way, you're going to get chronic health problems. We know certainly about 1 in 10 people with psoriasis definitely get arthritis, which is an inflammation of the immune system in the joints, and that runs along with psoriasis. And that happens somewhere between 1 in 10 and 1 in 5 people. We're not exactly sure, but it does. And it can cause problems with deformities and stiffening of the joints. And the classic symptoms are that people wake up in the morning, they feel their joints are sore or stiff, and it takes about a half an hour to actually work through that. But again, in modern terms, we're well able to treat that now. The vast majority of people, there are very good treatments for this. Crohn's disease is probably the other one, which is a form of inflammatory bowel disease. And again, that's your immune system in your gut is behaving abnormally, and that can result in quite severe complications, diarrhea, abdominal pain, narrowing of the gut, or what are called strictures. And psoriasis is more common in those people with Crohn's disease as well. People with psoriasis tend to have more social distress, and that can manifest itself in terms of depression. Now, that may well be if you've lived with a chronic disease which has made you miserable. And also, a lot of people with psoriasis don't sleep very well because their skin is itchy, their skin is sore. Now, if you've had young kids and you stayed up all night for 2 or 3 days in a row, or when I was a young doctor and I stayed up for 2 or 3 days in a row, it sort of distorts how you think. And if that's been going on in the long term for years, certainly these people then are more prone to have depression. Have more prone to have a high anxiety. There is no cure, but there are no cure for lots of things that people live with and yet leave perfectly normal lives with. And that's really the way we'd approach it and say, we can't get rid of this forever. If I had, the cure for this hopefully will come someday, but it isn't here now. But what we can do in the vast majority of people is we can control this ongoing condition for you so that it has minimal impact on the way that you live your life. And that means it may require medication, it may require visits to me, it may require medication that you need to inject yourselves with, but that we have the tools available for the vast, vast, vast majority of people to control this disease safely so that they live normal lives. Self-esteem improves, depression symptoms decrease dramatically, anxiety symptoms decrease dramatically, overall well-being does very well. Bottom line is, if we can improve the physical disease in the vast, vast majority of patients, the psychological problems that are associated with having severe psoriasis improve. Go and see your general practitioner, get some advice, and most GPs can treat most psoriasis. It's probably only about 20% of people that need to see dermatologists, but they're obviously the people with the worst disease. If your disease isn't being controlled by what the general practitioner can give you, or if they feel that your disease is too bad for primary care, then you need to see a dermatologist. Basically, you need to discuss with the specialist what you want to achieve. I mean, that's the key. What are we looking for here, and how safely can that be achieved? If you want complete clearance all over for the rest of your life, that's more difficult to achieve. But what I've said to you earlier is that we should try and get your skin controlled so that this is a minimal impact on your normal life. And that is a very realistic aim and a very realistic goal of treatment. I'm a dermatologist, first of all. My interest is in people with skin disease. The more information that people can get with skin disease, the more accurate information that people can get with skin disease, the better they'll do, and that's what I'm interested in.